Hi, I'm Dr. Kosabevsky here at the Osteopathic Center, and I want to talk about a course I was recently at the RMTI Regenerative Medicine Training Institute. And the course was focused on adipose and bone marrow and PRP. And basically just new techniques and new technologies that have come out over the last couple months, the last year, focused on those fields. So what I want to start by saying is that being a doctor is a lifelong learning process. We're always learning. We're always looking for some new technology that's come out. And here at the Osteopathic Center, we really try and maximize our learning. We're always at a new conference or the new clinical trials, new studies, always looking for new things to bring to our patients. So because we really just want to maximize our patient outcomes, we want to be bringing the latest and greatest to our patients. So at the course, really the biggest question is, why can two doctors who use the exact same product end up with two different results? And that kind of comes down to a couple of things. Really, the biggest, the most important thing is the practitioner's injection techniques, their knowledge base, and their skill level. That makes the biggest difference in the results of your injections. And then the next thing becomes, are the patients relaxing? So the study that they showed at this conference were that a large majority of your healing actually happens in the first 24 hours after the injection. That's when you get the biggest infusion of all the good healing factors. So that's why it's so important to go home and chill on your couch for about 1 to 2 days after the injections to give your body the best chances of recovery. And then the other thing to remember is that we don't want you rushing right back to your activity. The way you kind of have to think about it is that we're regenerating your tendons, we're basically building new cells in that area, and those cells aren't used to being stressed like your old tendons are. Those injuries are there for a reason, and your body is no longer used to that level of activity. So you have to work your way back slowly to your old level, ideally under the supervision of a physical therapist so they can truly guide how you return to activity. So in summary, the biggest differences are that you want to look for someone that's using a quality product, which we research every product we use here in great detail. We make sure where it's coming from, how it's being made, and how it gets delivered to us are all top tier. You have to make sure that your physician's techniques and skill levels, they're appropriate for the injections that they're doing. You have to remember to rest and relax after your injections and allow increased blood flow to that area. That's the swelling that happens. You really do want to see a physical therapist for a few weeks after so that they can guide your return to activity. And of course, really the most important thing is to have a positive attitude.